Joining me now is Dr. Soumya Swaminathan from the WHO. Ma'am, thank you so much for giving out your precious time for this interview to India Today. First of all, ma'am, I just want to know your assessment of COVID at the moment because India has begun witnessing a fall in cases as well. But do you think the pandemic is nearing endemicity, a word we've used a lot in the past 2 years, ma'am?
So globally, the pandemic is still very much, I think, a pandemic. And this is because we still have, 5 to 6 million cases being reported to us every week with somewhere in the range of 14 to 15,000 deaths. This has been consistent for the last several weeks. Of course, there are different countries, different parts of the world where, the infection goes up and goes down. But globally, we can see that this infection is still taking a toll. And of course, the most vulnerable and the people who are dying, looking at data from countries where they have analyses on who's unvaccinated, who's got 2 doses, 3 doses, etc., there is clearly a much, much, much higher risk of people who still don't have the vaccine, who have still not taken even 1 dose. They are the ones who are really getting ill and getting hospitalized, and many of them are dying. Whereas people who have received the primary course, and moreover, those who've received a 3rd dose, a booster, are the ones who have the most protection against severe disease, which is longer lasting. Now, having said that, obviously, as countries like India that have done well with vaccination coverage of the population, they now have a significant amount of population immunity. India also had a large amount of infections during the previous waves. And so overall, the population immunity at this stage should be fairly high. This doesn't mean that people will not get infected. We know that Omicron is a variant that can still evade immunity. It can overcome the immune response and still infect people. But in the majority of people, that will be mild because they already have some immunity built. Now, there'll still be people getting sick and in the hospital, but it will be much, much less, as we are seeing now, compared to what it was last year. Now, I think this question of endemicity, for diseases which have been around for a long time, that, take tuberculosis as an example, it still causes a huge amount of morbidity and mortality. There are still 1.5 million people, every year who die, and yet we say that TB is endemic. However, in the case of COVID, it's still a new infection. The virus is still changing. We anticipate that we will continue to see new variants. It has not stabilized. We have to wait for some more time to see, how it finally stabilizes. And so I think the goal of a country should be to have maximum vaccination coverage, but at the same time have the other tools in place. And people also should not believe that now we can give up all precautions, because it's important to reduce the transmission by wearing masks, by maintaining distance, and by improving ventilation. Because even mild infections can lead to longer term complications and sequelae. There's more data coming now about cardiovascular complications, neurological complications, etc. So it's best to avoid infection as much as possible.
And it's interesting that you mentioned this, because what kind of after effects or long COVID effects are we currently witnessing because of these infections, or because of lack of protection or immunity from vaccinations, especially when you mention cardiovascular problems or other such problems that are emerging?
So basically, what we're learning from the studies that have been done, where people have been followed up for a period of time, first is that there is a proportion of people, maybe 10, 15, or 20% in different studies, who develop something called post-COVID or long COVID, which means that even after 12 weeks after they've had the infection, they continue to have symptoms. And there are main groups of symptoms are fatigue, they're just not able to do the kind of things, the amount of walking or running they used to do earlier. The second group of symptoms is around neurological, what is called brain fog, just not being able to concentrate and focus on the work, as they used to do earlier. And a third group is around cardiovascular. There are people who've developed heart failure or irregular heartbeats, etc. But also there are these studies now showing that even up to 1 year, if you follow people up, there's a higher incidence of diabetes, there's a higher incidence of cardiovascular diseases, heart attacks, and people who've had MRI scans done have shown that there's also an impact on the brain, on the gray matter. There's some amount of shrinkage, which is very worrying because it may accelerate, things like dementia. And then you have the group of mental health disorders, depression and anxiety have gone up tremendously around the world, and especially in young people. And this is actually a much more difficult problem to tackle. So I think the health systems need to be prepared. They need to be aware of these possibilities and not dismiss patients who come to them with some, sometimes we just say, oh, this tiredness will go away, you just have to make an effort. It actually may be something underlying organic which needs to be investigated and managed. And I think already the burden of non-communicable diseases is very high in the population. A lot of people don't even know they have diabetes and hypertension. Unfortunately, having had COVID infection may increase that risk. And so I think it's really for the health systems, for doctors, nurses, hospitals, primary healthcare centers to get prepared to deal with the even larger burden of these diseases. But they can be prevented and treated and managed. So I think it's not that we cannot do anything about it. It's just that we need to strengthen those systems.
Absolutely, ma'am. We need to be more careful. But having said that, right now in India, at least, we're looking at a very low uptake of the booster or the third dose. Approximately only 11%, 11.69% of the entire eligible population in the country has got its third dose. Should the government look at some kind of change in strategy? Could they look at doing something different, because people are perhaps become more lax and they do not wish to take the third dose? That's the situation in the country right now.
Yes, and this is true all over the world. I think that people have now sort of believe that COVID is over and they can get on with other things. And of course, there are other priorities, and there are economic conditions as well as other health conditions that are equally important. So I think the strategy really is that we want to protect the most vulnerable, and therefore, if you look at the groups that are highest risk, are those above 60. Obviously, healthcare workers and other frontline workers who can be in touch, who have a higher risk of infection, but also those with underlying illnesses. And so I think it's really looking at the data disaggregated by those groups and then having strategies to really make it easier, more accessible, go to people. And I think India has done all of those things, really.
Yes.
But I think it's targeting those, because that's the way to actually keep the impact of the infection low, to keep the deaths low. So yes, everyone should get a third dose, because we know now that you need a third dose to have long-lasting protection and a broad immune protection. But on the other hand, in India, people have also had infection. A lot of people have had infection, plus 2 doses of the vaccine. That's also very good. It's called hybrid immunity. That's also protective. But now that the government is offering a third dose to everyone, I think we should really encourage people to take it up, and so that they remain protected. We're going to enter, the winter season. Many parts of India, it's going to be cold. People will be more indoors. There will be a higher risk of this infection as well as other respiratory infections. So it's one more way of protecting yourself, one added layer of protection.
So, ma'am, could we see a surge, or could we see a rise in cases, which will just subside after some time? Because that's what's been happening. COVID is coming back and going forward in waves now, all across the world as well as in India.
Exactly. And that's what we have to expect, that every 4 to 6 months that there could be a wave. The virus has become quite clever. It's learned how to change and mutate to adapt to our immunity. And every time it brings in some new mutations, which make it easier for the virus to spread and to escape our immunity. However, what we want to see is, even if the cases go up, that hospitalizations and deaths don't go up. So that's the uncoupling between infection and severe disease. That's where the vaccines have played their role. very, very effectively, and they continue to be effective in protecting against severe disease, even though the variants are changing. So I think there's a variant that's changing the virus. There's our immune responses. Our antibody levels do go down naturally after a period of 4 to 6 months, even though our cell-mediated responses may continue to protect us. And then there's people's behavior. So, for example, in the winter months, there's a higher chance of crowded indoor settings and poor ventilation. And so I think when these three things act together, you see these waves. I think we can expect to see them for the future. One area that has not received a lot of attention is ventilation. And I think in many countries now, people have started looking at how to make our schools and offices and shops and restaurants and malls more safe in terms of ventilation, wherever possible. Of course, natural opening doors and windows, having natural cross ventilation is good, but there are many air-conditioned places which need to start really looking at the number of air exchanges that they have and trying to bring in fresh air, when they are in their air conditioning system. So I think that's just not only for COVID, but also to reduce influenza, TB, other respiratory infections. I think paying attention to ventilation is something that's going to be important.
Ma'am, is WHO looking at tracking new variants, even though Omicron and its sublineages are pretty much dominating in most countries, but they're also showing some sort of immune escape potential?
Yes, so we have a committee called the Technical Advisory Committee on Vaccine on Virus Evolution, which continues to track the variants. Now, the way we track it, of course, is that countries, scientists from around the world are uploading their sequences into these public databases of whole genome sequences. And that enables, again, scientists around the world to actually look at that data, to analyze it, to visualize it, and to track the trends in real time. What's happened is that over the last few months, the number of sequences that are being uploaded onto GISAID has really come down from all countries because the testing has reduced. I think more people are going in for self-tests. So I think it's important it's really important to continue to track this variants that are coming and stay ahead of it and to understand each new variant as it comes, what impact it might have. So countries should really continue their strategy of sequencing samples, in a representative way and uploading them onto this database. As of now, as you know, Omicron constitutes over 99% of sequences uploaded, and BA.5 is the major variant globally, BA.4 to a lesser extent. But there are more sublineages now coming, even of the BA.2. There are mutations that are being described all the time. And I think what happens is eventually the virus keeps on trying to make different combinations. And then one combination of mutations actually then takes off because it has the advantage of either being more transmissible, being able to attach to the receptors more easily, or being able to evade our immune responses more easily, or a combination of both. And when that happens, that particular variant or subvariant, just takes off. So I think we have to keep watching, keep monitoring, and it's important that we continue to do that as a global community. And of course, WHO is watching, but we can only be informed if all countries are uploading, enough sequence data.
Absolutely, ma'am. Another big issue right now is the spread of monkeypox. Although we don't have many cases in India, we have perhaps 10 cases. Could be due to underreporting or no reporting at all of the virus. But in the US and other countries, it's spread a lot. Do you think that monkeypox virus could spread beyond the male sex network as well? Or is that even not possible that could happen perhaps because the male sex network at the moment is being told to be careful and has been told to take precautions even by the WHO?
So traditionally, monkeypox is a zoonotic infection. And in countries in Africa where it's been seen since the 1970s, it is an infection that's acquired from animals, mostly rodents, and often by children who are playing, in the forest. So it affects young children and adolescents, and then through them it spreads to other family members. And we've had these two for a long time two subtypes of the monkeypox. They used to be known as the Central African and the West African clades. Now we have numbered them as clade 1 and clade 2. Now, this year in 2022, suddenly we saw this very unusual phenomenon of monkeypox spreading in countries where it's normally not seen, except for the occasional, traveler who might have it, but spreading significant ways, and mostly in the men who have sex with men community. In Europe, North America, of course, now cases are reported in over 90 countries because it has spread. But wherever we have data, it's clear that the majority of them are men who have engaged in sex with men or are bisexual. But again, we have to be careful to say this is not a disease that only spreads through sex or only in this community. It is a disease that spreads through close physical contact because, it's the lesions, it's the vesicles on the skin. And if you are in contact, so it can be a child in contact with somebody who has this, or a family member, or a friend, or anyone. There have been cases described of people who have acquired it through attending concerts where there have been people packed close together, dancing and without any sexual contact. And so I think we have to remember that that's how it spreads. Yes, obviously during sexual activity, you have close physical contact and therefore it can spread like that. There are some women and children also affected in this particular outbreak. But since it's being fueled mainly in this community, most of our preventive actions and measures and information has been around this community so that they can take action to reduce the spread. And I think we're seeing the effect of it now. In many countries, it seems to have stabilized or on its way down, which is because of public health action, not because of vaccines, because vaccines are still in very short supply. So I think the message is that monkeypox, the main interventions we need are surveillance, detection or diagnosis of the cases, contact tracing, and making sure that people are isolated during that time and they're not in close physical contact with others. So you can actually stop the transmission and break those chains of transmission. People.
So, ma'am, bringing a proper vaccine for monkeypox, is that still debatable, or is that something that should still be a priority for countries?
I think, vaccine development for these diseases should be a priority. And for countries like India in particular, I think the whole area of vaccinology now has given us so much optimism and hope. And there's so much new science that's been done in the last 2 years. I think we're in a very good position now to really sort of relook at the vaccines that we have today and the vaccines that we could develop in the future. There are some ones that would be fantastic to work on, like a TB vaccine, better malaria vaccines, HIV, but also things like dengue. And then you have, of course, these emerging infections which come out of the blue. Suddenly you have Nipah, you can have there are hemorrhagic fevers which come up from time to time in India. And so having a vaccine that's developed, that's ready for use, would be a huge benefit for public health. And I think now the whole concept of having these prototype or platform vaccine technologies, which are ready for use, even if there's a new virus that comes up tomorrow, we should be able to quickly, using these new genetic technologies, develop a vaccine very rapidly. But that also requires attention to the clinical trial ecosystem and to the regulatory system, which all need to be geared up, so that that whole vaccine development process from beginning to end can be successful. And it has to be a public-private partnership.
Of course. Having said that, ma'am, are we also looking at a pan-corona vaccine at the moment? Because there are works going on a Omicron-specific vaccine as well. But is a pan-corona vaccine the answer to a lot of other lineages of COVID-19 that are still circulating across the world?
Yes, because coronaviruses are one of the groups of viral families that have a high risk of future pandemics. Again, the bats have a lot of different coronaviruses that are circulating. We've had already two in the past, right? SARS and MERS, and this is the third coronavirus, which in fact has been the worst. Influenza virus is same. So the WHO is actually doing an exercise where we're going to prioritize the viral families from which the next pandemic could come. so that vaccine development can focus on those. But for now, yes, I think corona, influenza, these both require like a pan vaccine approach, which covers all because influenza is the same. We change every year because the antigens keep changing. But if we could have a pan influenza vaccine that will be broadly protective and a pan coronavirus vaccine that can protect against many different species of coronaviruses, that will be perfect solution actually for the future.
And ma'am, we've also in India launched a HPV vaccine for cervical cancer, which is launched by the Department of Biotechnology as well as the Serum Institute of India. And we also know that cervical cancer has become a very big problem now. I mean, the numbers are just increasing because of the HPV virus. Could you tell us what kind of milestone step it is, just not for India and across the world as well? Because we've heard that the vaccine is going to be also the world's most affordable. It's going to cost perhaps less than 500 rupees or so.
I'm really delighted, by this news that we have begun the program of vaccinating girls with HPV vaccine. It's one of the few cancers that we can actually prevent because it's a cancer for which we know that the etiology is a virus. The other one, of course, is hepatitis B, hepatitis C, but HPV, which is a human papilloma virus infection, we know chronic infection can lead to cervical cancer, and therefore it's preventable. So it is really a fantastic news and a very good step that we are beginning the vaccination program. And one of the reasons why many countries have not started the program, even though they may want to, is the access, availability, and affordability of the vaccine, which there were only 2 companies and these were in limited supplies. Last year, a Chinese company also has a vaccine that's now pre-qualified by WHO. And now with the Serum Institute coming on board with an affordable, safe, and effective vaccine, I think it's one of WHO's goals, actually, cervical cancer elimination. It's a huge cause of mortality, morbidity for women around the world, young women. And so if we can scale up HPV vaccination programs in India and around the world, this would be a huge step forward for women to reduce one of the major diseases in women.
Ma'am, how soon could we be looking at a pre-qualification for this vaccine from the WHO?
I can't give you a timeline because actually I don't know where we are in that process and whether Serum Institute has submitted a dossier or not. But obviously they are a very experienced company. They have many pre-qualified vaccines. And so I'm sure that, they know all the processes. So I don't want to predict a timeline. It all depends on, the paperwork that's submitted and how it's reviewed. But I suppose that I anticipate that there should be a positive outcome on that.
Ma'am, my final question to you, where do you see this era of pandemics moving forward into the next decade? Because we've seen a COVID-19, we've seen a monkeypox, we've seen many other viruses come back. Some of them have actually occurred again, and being older viruses in some countries, being endemic in some countries, and now spreading across the world. How do you assess, is this going to be called in future an era of the pandemic?
Unfortunately, I think that we are at greater and greater risk of having these type of outbreaks and pandemics. And the reason I say that is because of the other factors around the world today related to climate change, related to deforestation, related to increasing urbanization and the way that we are treating our environment, cutting down our forests for either farms or for buildings where human beings want to live. But where will those animals go? Those animals will necessarily come greater contact and conflict with humans because we are actually going into their environment and disturbing them. And therefore also the other factor is the trade of wildlife, the illegal trade of wildlife around the world, because people want to eat a particular kind of animal meat, and then even these endangered species are trafficked around the world. And we've seen, what happens in these live animal markets when you have different species all crowded up together in one place. That's the perfect environment for viruses to spread from one animal to another and then ultimately to humans. So I think we now understand better the kind of risk factors that lead to a situation. So we have to address those risk factors as well and try and reduce our impact on the environment. But at the same time, we can also do other things to prepare for pandemics. We talked about vaccines. I think vaccines are a very good tool that we should develop and focus on, but also antiviral drugs. There are very few good antiviral drugs, available globally. So that's a whole area of research, again, for R&D, where India can take a leading role. But then again, the most important is the health system and the communities, because ultimately, infections, outbreaks, epidemics, pandemics all begin in a community and they end in the community. So the surveillance, particularly the community-based participatory surveillance, we have to really strengthen that so that at the very first sign of something unusual happening, that there is immediately an alert and investigation. Of course, then you need the lab capacity, you need people, you need epidemiologists at the district level who can go and investigate and find out what's happening. It doesn't always have to be an infection, it could be other things that are causing that particular outbreak, like toxins, which need to be investigated. So we need that capacity at that lowest level, at the district level, working, with the primary healthcare system. And then we need to strengthen, our data management so that all of these data sets are flowing in, that they're being analyzed at the state level, at the national level, and action is taken. So I think surveillance is very important, all elements. And now genomic surveillance, we know. We've seen recently New York detecting polio,
Right.
in the
Yes.
wastewater, the same in London. So again, we need to think about wastewater surveillance and other kinds of environmental surveillance, which can also give us a clue about the infections that are circulating in communities. And this is where also we often talk about the One Health approach. How can the animal, both wildlife and veterinary scientists, environmental scientists, and human virologists work together to get a better understanding, of that whole ecosystem. Of course, we cannot track every virus. There are too many. There are, tens of thousands, hundreds of thousands of viruses circulating around. But we need to really develop that field of being able to monitor, being able to track, being able to understand transmission routes. And then at the same time, we are preparing our countermeasures, the vaccines, the diagnostics, the drugs, which can be quickly scaled up, quickly adapted. And we also need our clinical care systems to be strengthened. And we saw this time during the pandemic that there were many gaps and deficiencies in the way in which we could actually treat patients, particularly in the smaller towns and villages. So we need to strengthen our clinical care capacities, make sure that there's oxygen, because oxygen is needed, for many diseases, not just for COVID. And now I think we're building that infrastructure in India and many countries, that oxygen was such an important basic thing that is needed. So I think we need to really map out what are all the areas which we need, where we are already very good, we're doing well, and other areas where we need to be further strengthening. It's a multi-sectoral approach, It's not just one sector or one ministry trying to do this, but preparing for future pandemics, just like preparing for the impacts of climate change, is something that's a whole of government and a whole of society solution.
That's right, Dr. Soumya Swaminathan. Thank you so much for joining us on India Today and giving us this important insight on what the WHO is currently doing and whether we're going to see another outbreak of the pandemic. I thank you very much for your time, ma'am.
Thank you very much. Thank you.
Thank you so much, ma'am. Take care.